I don't have a philosophical objection necessarily to a travel ban if that is the thing that is going to keep the American people safe. The problem is that in all the discussions I've had thus far with experts in the field, experts in infectious disease, is that a travel ban is less effective than the measures that we are currently instituting.
Back now to our Kelly file investigation, Ebola in America. That was the president on Thursday night defending the decision not to impose any kind of travel ban, despite growing calls from some doctors, a range of political leaders, and what is now a big majority of the American public. So why the opposition to the idea? Joining me now, Dr. Ben Carson, who's the former director of pediatric neurosurgery at Johns Hopkins Hospital and a Fox News contributor, and Kirsten Powers, who's a columnist for USA Today and a Fox News contributor. And we begin with Dr. Carson. Doctor, good to see you tonight. And so, on the travel ban, let me ask you this. So far, we have one person who came into the United States from Liberia with Ebola. Is it an overreaction to say we need to ban all travel from these 3 affected countries?
No, it's not an overreaction at all. It's actually common sense and logic. Why would you bring something dangerous in here or let something dangerous come into our country on purpose? Why have 22 other countries decided to ban it? Why have other African countries put up an isolation wall? Are we the only ones who are so wise and everybody else is a fool? I don't think that's the case.
How is this broken down into a weird partisan dispute? I mean, it's strange to watch how many conservative Republicans want the travel ban and many liberal Democrats don't. I mean, it just seems sort of weird that this has turned into a partisan issue. Why is that, do you think?
Well, there's so many things that we make into partisan issues now that are not partisan at all. They're things that affect all of us, but there seems to be this bandwagon effect, and that people see a person as their leader and they jump on that bandwagon without investing any intellectual thought into this at all. And all you'd have to do is ask yourself, if one of your loved ones was in proximity to somebody who had come from one of these countries, would you be comfortable? Would you be comfortable bringing that person in and putting them in proximity with your loved one? Let that be your guide.
You know, when I interviewed Dr. Frieden earlier this week, he said the problem is even if you instituted the ban and then you had charter flights taking doctors and health workers in and out, it would lower the flow of traffic of well-meaning people, you know, who wanted to help the folks in Africa. And he thinks that that would create an expansion of the disease over there. He thinks even a limited travel ban would really lead to an expansion of Ebola in Africa, which he says is bad for us.
Well, one of the things that I've been saying for several weeks now is, you know, let's get rid of the foolish argument